Hi, I'm Tom Falborn with Benz Models, and I'm reading for the part of Dr. Landers, and here are my profiles. So, based on my examination and evaluation of your medical history, I've concluded that you're suffering from a mood disorder.
What exactly does that mean?
Your mother has a bipolar disorder.
What? I'm not crazy. If I'm crazy, then so is half this city. Have you ever been to a 24-hour donut shop? Everyone's certifiable.
It's very common for people with bipolar disorder to act as if nothing's wrong.
Because nothing is wrong. I feel fantastic.
Elaine, you feel great now because you're in a manic state. But there's another side to the syndrome, and it manifests as depression. And judging from our conversations, I know you've been there. Your condition, if left untreated, can be very dangerous.
But it can be treated, right?
With the right medication, therapy, and exercise, you can lead a completely normal life. It's classic manic behavior: impulsive, reckless, poor judgment, an inflated sense of importance.
Oh, come on. It's funny.
Miss Bingham, try to respect these proceedings. Counselor, continue.
Dr. Landers, you examined Miss Bingham, so please share your conclusions with this court.
She meets the criteria for bipolar disorder under Section 340-2 of the Diagnostic Manual.
What exactly is that?
It's the American Psychiatric Association's Manual on Mental Disorders.
Doctor, can you explain the diagnosis in simple layman's terms?
Mrs. Bingham suffers from cyclothymia, a variant of spectral bipolar disorder. She cycles to the highs of hypermania to the lows of depression.
At the time of the incident, her blood work revealed the presence of an antidepressant called Lexapro. Is that a proper way to treat bipolar disorder?
No. When a bipolar patient is given Lexapro, it can trigger a full-on manic phase. I believe that's what happened to Mrs. Bingham. She no longer had control of her actions.
No longer in control? Thank you, doctor. Dr. Landers, if a patient knew she were bipolar and asked for a prescription for an antidepressant, wouldn't she then be responsible for her actions?
Yes, of course. In that situation.
And were you aware that Elaine Bingham was first diagnosed with bipolar disorder 13 years ago, doctor?
No, I had no idea.